Different types of anxiety disorders. By Dennis Relojo-Howell. Anxiety is a common human experience, but it can become overwhelming for some individuals and interfere with their daily lives. Anxiety disorders are a group of mental health conditions characterized by excessive and persistent worry, fear, and apprehension. While anxiety disorders share some common features, there are also distinct types that present unique symptoms and challenges. Generalized anxiety disorder, GAD. Generalized anxiety disorder is one of the most prevalent anxiety disorders. People with GAD experience excessive and persistent worry and anxiety about various aspects of their lives, such as work, health, relationships, or everyday situations. These worries are often unrealistic or disproportionate to the actual circumstances. Physical symptoms like restlessness, irritability, muscle tension, and difficulty concentrating are common in individuals with GAD. Panic disorder. Recurrent and unexpected panic attacks characterize panic disorder. Panic attacks are intense episodes of fear or discomfort that reach a peak within minutes, and are accompanied by physical symptoms such as a rapid heartbeat, sweating, trembling, shortness of breath, and a feeling of impending doom. People with panic disorder often live in fear of experiencing another attack, which can lead to avoidance of certain places or situations. Social anxiety disorder, SAD. Social anxiety disorder, also known as social phobia, is characterized by an intense fear of social situations and a persistent concern about being embarrassed, humiliated, or judged by others. People with SAD may avoid social interactions or endure them with extreme distress. Common situations that trigger social anxiety include public speaking, meeting new people, eating in public, or participating in group activities. Physical symptoms such as blushing, sweating, trembling, and nausea are common during social anxiety episodes. Specific phobias. Excessive and irrational fear of specific objects, animals, or situations characterizes specific phobias. Common phobias include fear of heights, spiders, flying, needles, or closed spaces. Individuals with specific phobias may experience intense anxiety or panic attacks when confronted with the feared stimulus. They often go to great lengths to avoid the object or situation, which can significantly impact their daily lives. Obsessive-compulsive disorder, OCD. Obsessive-compulsive disorder is an anxiety disorder characterized by intrusive, unwanted thoughts, obsessions, and repetitive behaviors or mental acts, compulsions. People with OCD often feel compelled to perform these rituals to reduce anxiety or prevent a feared outcome. Common obsessions include contamination fears, excessive doubt, or intrusive thoughts about harming oneself or others. Compulsions can manifest as repetitive hand-washing, checking, counting, or arranging objects in a particular order. Post-traumatic stress disorder, PTSD. Post-traumatic stress disorder develops in individuals who have experienced or witnessed a traumatic event, such as war, natural disaster, physical or sexual assault, or a serious accident. Symptoms of PTSD include intrusive memories or flashbacks of the traumatic event, avoidance of reminders, negative changes in mood and thinking, and heightened arousal, such as being easily startled or having difficulty sleeping. PTSD can significantly impact a person's quality of life and relationships. Separation anxiety disorder. While commonly associated with children, separation anxiety disorder can also affect adults. This disorder is characterized by excessive fear or worry when separated from attachment figures, such as parents, partners, or close family members. When separated from their loved ones, people with separation anxiety may experience intense distress, physical symptoms, and persistent thoughts about potential harm or loss. Selective mutism. Selective mutism is an anxiety disorder characterized by the consistent failure to speak in specific social situations, despite being capable of speech in other settings. Individuals with selective mutism may experience extreme shyness, fear, and anxiety that prevents them from speaking, particularly in public or unfamiliar environments. This condition often manifests during childhood, and affected individuals may only feel comfortable talking with trusted individuals, such as immediate family members. Selective mutism can significantly impact a person's educational and social development, and early intervention with appropriate therapeutic strategies is crucial. It's important to note that anxiety disorders can coexist with other mental health conditions, such as depression, substance abuse, or eating disorders. They can also vary in severity, with some individuals experiencing mild symptoms while others face significant impairment in their daily functioning. If you or someone you know is struggling with anxiety, seeking professional help is crucial. Treatment options for anxiety disorders include therapy, such as cognitive behavioral therapy, medication, or a combination. Therapists and psychiatrists can provide tailored interventions and support to help individuals manage their symptoms and improve their overall well-being. Takeaway: anxiety disorders are characterized by excessive and persistent worry, fear, and apprehension. Generalized anxiety disorder, panic disorder, social anxiety disorder, specific phobias, obsessive-compulsive disorder, post-traumatic stress disorder, separation anxiety disorder, and selective mutism are among the different types of anxiety disorders. By understanding these conditions, we can better recognize the signs, seek appropriate help, and support those affected by anxiety disorders in their journey toward better mental health.